appropriate statements with you. Okay, so let's go very quickly to the second question over here. So we have 5 questions that I have prepared. All right. So this is reading for specific meaning. Okay, this will be helpful in OET reading part B or reading part C. So the question is, in a hospital memo, to reduce fault risks, staff must complete the mobility checklist before transferring patients. Okay, so this is the dialogue over here. This is the statement over here. Okay, to reduce fault risk, staff must complete mobility checklist before transferring patients. Now, what is the main purpose of this memo? What is the main purpose? The skill is very important for reading part B. Understand the question. Without understanding the meaning of the question, do not be in a hurry. So everyone has gone with answer option B. All right, so maybe 5 more seconds. Purpose basically means what? Why? Okay, the reason. Okay, so here when you read the statement, you should not give importance to the direct meaning. You must think, why was this statement written? Okay, what is the purpose? Okay, what is the reason? Okay, that is what you need to find out. So here the answer option, the right answer option is going to be A. So see, what is the statement telling over here? Okay, so we'll be discussing reading part B today. So this skill is going to be very important. So here the hospital document is telling to reduce fall risks. That means what? Patients are a risk of falling down. Okay, patients when walking, they are a risk of falling down. So we want to reduce falling risks. Okay, to reduce that, what must the staff do? The staff must complete the mobility checklist. Checklist means what? Like checklist, right? So tick number 1, tick number 2, tick number 3. Okay, so we must make sure the patients undergo a mobility test, okay, and they complete the mobility checklist before transferring patients. So if they do this, there will be reduced fall risk. Okay, so this is patient care. To ensure patient care, the staff must do the mobility checklist. So what is the purpose of this memo? What is the reason? Why was this memo sent to the people? To provide information on patient care, right? So we want to provide care for the patient. Okay, so since we care for the patient, we tell, okay, we want to reduce patient risks, fall risks. So therefore, you please make sure you finish a mobility checklist and then only you transfer the patients. Okay, so here it is providing information on patient care procedure. So this is how tricky the OET can be. Okay, so now over here to describe the patient's shift, okay, handover process. Again, that is not the reason. So when you read a statement, if it's a purpose type question, you really have to reflect. So you must never be in a hurry over here. You must actually think, reflect, and then come to the right answer option. Okay, so very good. Both everyone who has participated, good job. All right, so now let's go to the third question. So this is grammatical accuracy in written communication. All right. So this is the question over here. The question over here is, which sentence is grammatically correct for an OET referral letter? Grammatically correct sentence. Has everyone participated? We have C option, we have A option. Okay, we have C and A most commonly. 5 more seconds. Which sentence is grammatically correct? So the right answer option is B. Okay, so everyone got it wrong. No worries. Okay, so here you have to give importance to singular and plural tense. So those who chose answer option A, okay, what is the tense over here? See, the patient, how many people are here? Just one person is here. Okay, now we use have. When do we use have? We use have when there are minimum two people, when the tense is plural. Okay, two patients, three patients. Okay, they have been. Okay, but over here there is just one person. So the patient has been will come. Okay, the patient has been experiencing intermittent chest pain. So we cannot choose answer option A, right? Now, what is C option telling? The patient complaining about chest pain. The patient has been complaining. Say ing is coming. Ing is what? Present continuous tense. Okay, so has been, or you can even the patient is complaining. Okay, this will not come. The patient has been complaining. Now see over here, ing is coming over here, right? So when ing is coming and there is just one singular person over here, then has been will come. Okay, so here has been is missing. Now you read answer option B. The patient reports. See, the patient reports that he has had chest pain since last week. So what is has? Has is present tense. Okay. What is had? Had is past tense. Since last week. Since last week continuously. So since last week, that is 1 week ago, the chest pain began. Okay. That is past tense. And it is still continuing to today. Okay. So there has been no rest. Okay. The patient has been continuously suffering chest pain since last week. And the patient is still having. So that is when we use has had. Okay, the patient reports that he has had chest pain since last week. Okay, that was a slightly tricky question. So you have to like give importance to the grammatical range as well, especially when you're writing letters. This is very important, even when speaking as well. Okay, so anyway, good job. Let's go to the next question over here. Medical idioms and expressions. Idioms are basically figurative speeches. Okay, so let's read the sentence over here. In medical notes, the phrase, the patient's condition is touch and go. Okay, so touch and go is basically what we call as idioms. Idioms or metaphors or expressions. Okay, there is no touching, there is no going over here. It is just an expression, but you need to identify what is the meaning of that expression. So is it A, B, or C? Condition is touch and go. All right, so we have majority of the candidates going with answer option B. So B is indeed the right answer. Okay, so this is what we call as figurative language. Figurative language basically means the opposite of reality. Okay, so there is no really, there is no touching and there is no going. It is just an expression. Now see over here, the patient's condition is touch and go. Okay, that is the patient's condition will come to the patient for 1 or 2 days, it will stay there and it will go away. And then after 5 or 6 days, once again it will come back. It will stay there and once again it will go and once again it will come back. Okay, so that is what we call. So it is very unstable. The patient's condition is unstable and it is not at all predictable. It is uncertain. Okay, so that is the phrase over here. So the right answer option will be answer option B. Okay, so good. Now let's go to the fifth question. Prioritizing patient-centered care. This is a speaking skill question. Now the question is, a patient refuses to take their prescribed medication. What is the most appropriate approach? A patient is refusing to take their prescribed medication. So you're having a consultation with the patient. The patient is saying, no, I will not take this medication. So when you encounter such a patient, how will you deal with the patient? What will be the most appropriate approaching strategy? Right. So we have everyone going with answer option D. So B is indeed the right answer. Okay, very good. All right, B is indeed the right answer. See, when the patient is saying, Doctor, I'm really sorry, I don't want to take this medication. Okay, so you have to first of all understand. So you can say, oh, Mr. John, I completely understand that you have your own reasons to not take this medication. I respect that decision of yours. However, this is your condition and you really need to improve your situation. So therefore, let me take a moment to talk about the benefits of this medication. So you talk about the benefits and then you talk about the risks. Okay. And if you do not take this medication, then these are the complications that you will inevitably face. Okay. So please try to understand that I'm doing this for your own benefit. So in the meantime, if you have any concerns, please feel free to share your concerns with me. Right. So like this, you must be able to counsel your patient. Okay. So this is what we call as patient-centered care. So when your audio becomes recorded, okay, so when you go to the OET speaking test, your patient counseling, your audio will be recorded, and this audio is sent to Australia. And those people, when they're listening to your audio, this is what they really look into. How much professionalism do you have when it comes to dealing with patients? That is why the OET is a medical test, and just someone with good English will not pass the OET. Okay, they need to have the skills that is required to be a good medical professional. Right. So B will be the right answer. Okay, so good, very nicely done. So I'll be sending you this document in the WhatsApp group later on. And I'll be also sending the link to the recorded session as well. Right. So now what we're going to do is we will be practicing reading part B. Okay, so this is a Cambridge University material. Okay, so those who are very serious of passing the OET, okay, do not overcomplicate your OET preparation. Okay, there is no point in doing hundreds and hundreds of materials if you're just doing a handful of materials, but those materials, if you're doing very smartly, very cleverly, okay, thoroughly, if you're doing very pleasantly and very enjoyably, you can clear the OET and get the desired OET scores. That is the benefit of practicing with the Cambridge University materials. Right. So reading part B are basically short workplace extracts. Okay. Short workplace extracts. So what you need to do is you need to read the workplace documents, short extracts. So from a very long, lengthy document, what they will do is they will take short excerpts. Okay. And then you have to go through the questions, answer options, and whichever answer option you feel is the right answer, you have to choose. Okay. So as you can see over here, this is how you have to shade the correct answer with your pencil. Right. And just like I mentioned in yesterday's class, you can underline, you can highlight, you can do whatever you want. The area where you're highlighting the answers, make sure that area is kept very neat. Okay, so when it comes to reading part B, the strategies are different. Okay, because yesterday's class we discussed about reading part A. So there we have fill in the blank questions, we have short answer type questions, we have mastery following. Okay, and also there is a very strict time limit. Okay, so there the skills are entirely different. Okay, there you need to have prioritization skills. You need to know which to prioritize, what question types to prioritize. You need to have good intuitive skills, skimming skills, scanning skills, right? Keyword analysis, comprehension, retention, and all that. But when it comes to reading part B, workplace extracts, here the strategies are different. Okay, so we will be discussing that with the help of few questions. All right, so first, let me see if you are able to find answer to this question on your own. Okay, so this is the third question. Okay, so let me see if you are able to read the question and find the answer on your own. And then once everyone has participated, then I will give my explanation. Okay, so I'll give everyone 2 minutes time maximum to read the question and type your answer in the chat box. This is actually a very tough question, not very easy. Hmm? So I'll give you 10 more seconds. All right. So let's talk about the strategies. Okay, so I have prepared a document over here. Okay, so that document, okay, let me just show you the document for this particular question. So once I discuss the document, then basically I will be showing this document to you. And also I'll be sending this particular document in the WhatsApp group as well. And in the OET Exam Mastery app, we have already recorded the very detailed lectures. So that 24/7 is available. You can utilize the app for your preparation process as well. So here, this is the question. And this is the thing that we are going to be discussing. So the right answer is answer option A. Okay, so I'll explain to you why A is the answer, right? And I'll also explain to you what is the question type. Okay, so this is a purpose type question. Okay, so purpose basically means you need to think why this text was written. Okay, so you have to identify the question type. Identifying the question type is important. Purpose type questions basically means you are not looking for a factual information. You are not looking for a direct answer. You have to reflect. Okay, you have to read the entire thing and you have to ask yourself, why was this written? What was the intended meaning? What is the reason? So that is not mentioned in the text. Okay, but that is something that you come to your own conclusion. That is what we call as inference skills. Okay, you have to focus on the overall aim, not just individual details. If you're focusing on individual details, then you fall into the trap of OET and it will be a problem. Okay, and there are certain skills that is required here, and we'll also be discussing about the vocabulary, and also I'll explain to you why B and C is wrong as well. Okay, so that we will do later on. So first, let's just take a look into this particular question. Now, strategy number 1, reading the paragraph first, okay, and then reading the question. Okay, reading the paragraph first and reading the question. Will you get the answer? Yes, you will get the answer. Reading the question first and then reading the paragraph. Will you get the question? Will you get the answer? Yes, you will get the answer. Now the question is, if both strategies work, if I read the question first and then if I read the paragraph, I'm able to find the answer. If I read the paragraph first and then if I read the question, I'm able to find the answer. So among this, which strategy should I use? So my advice is, first foremost, you see what works for you. Okay, so everyone's brain is wired different. So if you feel comfortable with reading the paragraph first and then reading the question, if that is your comfort zone, then yes, by all means, you can stick to that. But if you ask me, we are doing the OET reading after we do the OET listening test. Okay, and listening is the most challenging exam in OET without a doubt. Okay, it depletes a lot of your mental energy. Okay, it is very draining examination, part A, B, and C, and then you're doing reading part A, and then you are doing reading part B and reading part C. Okay, so by the time you reach reading part B and C and all, you are a little bit tired on the examination day. Okay, so that exhaustion is there. And also there is this nervousness aspect as well, because you're in the exam situation, your brain is in a high pressure situation. Okay, so that exam anxiety, that exam nervousness, that nervous energy will always be there. And you are practicing, you are confronting this exam, this question in that mindset. So that challenging aspect is there. And then we have a very strict time limit. Okay, within 45 minutes, you have to finish 22 questions. In reading part B, we have 6 questions. Reading part C, we have 16 questions. So total 22 questions, all very complex questions, and we have only 45 minutes. So we have a small time restriction as well, right? So your duty is not to simply find the answer. Okay, your duty over here is to find the answer within the limited time, okay, with limited resources in a high pressure situation. That is your duty, right? And for that, you need to have the best strategies. So when a student is reading this paragraph first without reading the question, okay, they don't know what they are looking for. Okay, without reading the question, if they come here, they don't know what question type it is. They don't know whether it is an opinion type question. They don't know whether it is a reference type question. They don't know whether it's a direct question. They don't know whether it is a purpose type question. They don't know whether it's a function based question. They don't know anything. They're simply blindly reading and they don't know what they're reading for as well. It is aimless reading, and the student has to put in a lot of effort trying to understand each and every word. But on the other hand, if a student is reading the question first, the student knows, okay, this is a purpose type question. That means after read this thing, I must understand why this was written, the reason for writing, the why for writing this particular paragraph. And over here, it is about an incinerator. Okay, so why were these notes about an incinerator written? So with that clarity, and then you read through the answer options. So you know the keywords here as well. So what does the student have? The student has much more clarity. Okay, much more wider understanding. And with that clarity, if the student is reading, of course, the student is going to get a much more benefit, right? And not only that, maybe the answer will be sometimes, okay, if it's a direct question and all, maybe the answer will be in the first 1 or 2 sentences itself. Okay, so if you have read the question, then you can easily say, this is the answer. So if you have already confirmed the answer in the very beginning, then there is no need for you to waste your time and energy reading the remaining paragraph, because it's an easy question. And since you read the question, you're able to say with 99% accuracy, this is the answer. So this is the benefit of reading the question first. If you read the question, you will be able to save your time, you will be able to save your energy, and also you will be able to achieve a lot more clarity and efficiency when you're trying to find the answer. So my advice is always give priority to the question, because OET is giving you marks for finding answers to the question. OET is not giving you marks for reading the paragraphs. Okay, so that is strategy number one. Now, how should you read the questions? Okay, simply reading, the purpose of these notes about incinerator is to help maximize its efficiency, give guidance on certain safety procedures, recommend a procedure for waste separation. Are you supposed to read like this, or should you actually put in some effort and understand the meaning? Okay, so if you're simply blindly reading, then if you read it 2 times, 3 times also, nothing will register into your mind. Here, you have to have good grasping skills. So when you're reading, as you're reading just one time itself, you must be able to grasp the meaning and go. Okay, so take some time. So when it comes to the question, it is very important that you actually put a 10% extra effort, because without understanding the question, there is no point in understanding the paragraph, right? So here, when you're reading, there is no problem in actually putting a 10% extra effort to understand the question, right? So over here, I'll teach you 3 common methodologies, step number 1, 2, and 3. So let me just type it over here, something that we discussed in yesterday's class and in many previous sessions as well. Comprehension, followed by retention, and followed by detection, right? So step number 1 is to comprehend the question, that is, understand the question, doing the keyword analysis. So once you have understood the question, then you must have a good memory of the question. You must retain the focus of the question to your memory. Okay, so with a very thorough memory of the question, only then you must go and try to detect the answer, right? And over here, what type of questions are we doing? We are doing multiple choice questions, right? So when we are doing multiple choice questions, instead of trying to choose the correct answer, give importance on eliminating the incorrect answer options. Okay, so this is what we call as the elimination strategy. So elimination strategy is particularly useful when you're dealing with highly challenging questions. That is, you're not trying to choose the correct answer, but to be more conform, to be more certain, you're eliminating the incorrect answer options one by one, and whichever answer option is the most difficult to eliminate, that will be the right answer. And for refining your elimination strategy, there is something called as the verb analysis. Okay, verb analysis as well as the keyword analysis. Okay, so I will be talking to you what is keyword analysis, what is verb analysis, and using these 2 strategies, how to perfect your elimination thing, and so that you're able to pinpoint the correct answer. Okay, so let's do the comprehension. Step number 1 is comprehending the question. Okay, so let's do that. So the question is asking us, the purpose of these notes about an incinerator is to. So here, the purpose means what? The reason. So some notes has been written about an incinerator. So what is an incinerator? Incinerator is basically a machine that turns anything into ash. Okay, you put anything inside it. It burns at a very high temperature and it reduces it to ash. Okay, that is what we call as an incinerator. It is not simply burning it, it is reducing anything to ash. So that is what we call as an incinerator machine. Okay, so here the question is asking you, why are these notes written? What is the purpose of these notes? What is the reason for writing these notes about the incinerator? The reason. That is what you need to find out. So you have that clarity. Okay. Now, what is answer option A, answer option B, and answer option C? Answer option A, answer option B, and answer option C are all related to the purpose of the question, right? Answer option A, maybe for this reason, this notes was written. Maybe for reason option B, it was written. Maybe for answer option C, that was the reason for writing these notes about this incinerator. Okay, so now let's do the keyword analysis of the first question over here. Right, so let's do the very first question. Okay, help maximize its efficiency. Okay, now over here, what is it referring to? Okay, so in OET, you will very commonly come across these prepositions. Okay, so this it is referring to the incinerator. You must always be able to make that connection. This, that, them, their, its. Okay, that connection you must be able to make. Without that accurate connection, it will become very challenging. Okay, so over here, the it is referring to the incinerator. And what is the keyword over here? The keyword over here, help maximize its efficiency. Okay, so the purpose for writing these notes is to make sure that whoever is operating this machine will ensure that the incinerator works very nicely. Incinerator works very efficiently to maximize it. It's 100% peak performance. Okay, to ensure that these notes were written. That is reason number one. Now, what is reason number two? The purpose of these notes is to give guidance. Guidance basically means what? Help. Okay, is to help them. Okay, is to help the staff on certain safety procedures. Okay, procedures basically means what? It is a step-by-step process. Okay, that is what. Okay, so this is a safety procedure, and I'm helping you to do these safety procedures. That is what answer option B is telling. And answer option C, recommend a procedure for waste separation. So here, what is the keyword over here? A procedure. A procedure. A means what? Just one. Okay, so here the purpose of these notes is to give, one particular procedure for separating the waste. Okay, so again, I'm taking a little bit time over here because only then you will be able to understand how to do the keyword analysis and all. Okay, because especially when it comes to the question, you have to put in that extra effort. Okay, because over here, answer option is A. And I don't think much of you actually got the correct answer as A. So that's the reason why I'm going into little detail over here. So this is what we call as the keyword analysis. Now, little bit more importantly, there is something called as the verb analysis, right? Verb, V-E-R-B. Verb means what? Verb means an action, any kind of an action, any kind of a movement. That is what we call as a verb over here. So the verb analysis will help you to eliminate the incorrect answer options little bit more easily. I'll explain to you how. So over here, the question is the purpose. Okay, so our duty is to find why these notes were written about this incinerator. So what is the verb over here? Help maximize its efficiency. So what is the action over here? Help. Okay, help is a movement. Okay, that is the verb over here. Okay, so it is helping. Okay, the purpose is to help the reader, okay, improve the efficiency of the incinerator. Okay, help the person. That is the verb over here. That is what we call as verb analysis. Now, what is the verb in answer option B? To give guidance on certain safety procedures. So what would be the action over here? What would be the main verb over here? Give guidance on certain safety procedures. Over here, we can say it is guidance. Okay, guidance, and again, safety procedures also. This is also a verb over here. Okay, so I would say answer this would be, okay, certain safety procedures. That will be the more correct answer. Okay, so we can give safety procedures as the main verb over here. So this is the main purpose, okay, to talk about, to give guidance on the safety procedures. Now, what is the verb in answer option C? Okay, recommend a procedure for waste separation. So we have recommend, that is a verb over here, but the more profoundly, we have waste separation as well. But I would suggest that it is recommending, both are correct. So I would say that waste separation, okay, recommending both. I would choose mainly both as well. It is recommending, okay, on how to separate the waste over here. All right. So like this, okay. So like this, we can actually, this is a very tricky question. So therefore, all these words are also a little bit linked. Okay. So like this, what to do is you just identify the focal point. So the verbs are basically the focal point of the answer options. help. The reason of these notes is to help the reader improve the efficiency. The reason for writing these notes is to give guidance on safety procedures. The purpose is to recommend, that is to suggest how to do one particular method for waste separation. Okay, so like this, you have to give little bit importance to the question because thorough comprehension of the question is important. The 10% extra effort that is definitely going to help you out. And with that retention, okay, so that memory should be very solid in your mind. And with that memory, you should come to the question over here and you must try to pinpoint the correct answer. Okay, so let's read the part B question, paragraph. Low cost incinerator. So this is a low cost. Low cost basically means what? It is a very cheap. Okay, it is not an expensive incinerator. It is a very cheap incinerator and general operating notes. Now your duty is to find, okay, why? Why did the people write these notes for a very cheap incinerator? That is your duty. So you're reading with an aim. You're reading with an intention. That is the difference over here. So we have one particular heading, hospital waste management. So when so hospital will generate a lot of waste, and some of the waste we actually burn them. We burn them in incinerators. Okay, so regarding waste management, how to utilize these incinerators. So here they're telling materials with high fuel values. Fuel means anything that burns. Okay, anything that burns and generates energy, that is what we call as fuel. So high fuel values basically means what? Something that burns very good, something that burns very very easily, and anything that produces a lot of energy, that is what we call as high value fuels. Okay, so like that you must be able to understand the meaning and go. So materials with high fuel values such as, and plastic is a fuel, paper is a fuel, card is a fuel, dry textile. So these are all fuels because why? They burn very easily, okay, and they produce a lot of energy. So that is why they are called as materials with high value fuels. Okay, now they're telling materials such as these will help maintain. Now you see the key word over here is it will help maintain high incineration temperature. So when we are using this cheap incinerator, if you want to maintain a very good temperature, one helpful advice is to use a lot of high value fuel materials. Okay, so that is the first sentence. So it is helping the person. It is helping the person how to ensure that is high incineration temperature inside it. And now they are giving a recommendation. If possible, a good mix. Okay, if possible, a good mix of waste materials should be added with each batch. Okay, so you know whenever we are using whenever we after one batch when we're adding the next batch into it, a good mix, okay, that is, you know, don't put only plastics, don't put only paper, don't put only dry textile, mix all of them together, mix all of them together and then put into the each batch. Don't put just one particular thing. Now that is another helpful advice. Okay, that is if you want to utilize this insulator very very nicely, then you give a good mix and then you put it into the batch. Okay, another helpful advice. Now, this can be best achieved. Okay, so how can we achieve this? This can be best achieved by having the various types of waste materials loaded into separate bags at the source itself. Source means what? Where the place where you are collecting the materials, okay, the collecting the waste. So from the source itself, you put, you know, the waste materials into separate bags, plastics in a separate bag, paper in a separate bag, dry textiles in a separate bag. Okay, so like this you have separate bags for each material. Don't put everything inside the same bag, have separate bags. So this is a advice. Once again, it is a helpful advice. Okay, so that whenever you are putting each batch into it, okay, that batch burns very very nicely. Okay, example, wards and laboratories. So these are the sources. So hospital wards, hospital laboratories, from there itself you have to collect the waste in separate bags. It is not recommended. Now you see over here, now they're telling it is not recommended that the operator means who is using this machine, operator sorts and mixes waste prior to incineration. That is just before incineration, just before putting the things inside the thing, that is not the time to, you know, mix everything and sort everything, because that is dangerous. Okay, so over now they're telling, okay, it is very very dangerous to the person just before the incineration process to actually do this. And once again, they're telling, if possible, some plastic materials should be added with each batch of waste. Now, once again, they're telling to maintain high temperatures. So if you want to keep very good temperature, if you want this machine to work very efficiently, okay, you have to put plastic materials into each batch. Okay, so that you can maintain the high temperatures, because why? Plastic has very high fuel values. And finally, they're telling, however, even though, so plastic is highly flammable, right? Plastic is highly flammable. So they're telling care and judgment, okay, will be needed, as too much plastic. Now see, plastic is a very, very high fuel value source. Okay, so too much plastic will create dense, dark smoke. Okay, so like this, we have read the entire text over here. Now this, see, purpose type questions are basically inference questions. Inference basically means the answer will not be here. Here you have to read and you have to reflect. Now, what is the reason? What is the reason for writing these notes? So now let's come to the answer options over here, right? So we have three answer options. So we have done the verb analysis before. So the verb over here is help the person maintain, maximize his efficiency, give guidance on certain safety procedures, and then recommend one procedure for waste separation. Now, you tell me, we have read this entire thing in full detail. What is the purpose? What is the reason for writing this letter? So this is a little bit tricky question, because here we have to use our reasoning skills. You have to use self-reflection over here. Now, let's see if the verbs are mentioned. Okay. Do you think the purpose of this nose is to help maintain the efficiency? Yes. So this is a very cheap incinerator. It is not a very expensive incinerator. So in order to maintain high temperatures, we have to add plastics, paper, this thing and that thing. Okay. And you have to sort the waste in the source itself. And then with each batch, you have to give a good mix. So everything we are writing, and the purpose is to make sure that this cheap incinerator works very nicely in high temperature. Because if there is high temperature, then everything will be reduced to ashes. So help, that is the verb over here. Efficiency, all these keywords and verbs are mentioned. So you can say A could be the right answer. Okay, you highly suspect that A could be the right answer, because the verb analysis we have done, the keyword analysis we have done, and everything is matching to the purpose. Now let's come to answer option B. What is B telling us? To give guidance on certain safety procedures. Okay, that is when you are using the incinerator, how to be careful. Okay, so over here, when you read the answer options, when you read the passages over here, regarding what exactly is the safety telling over here, they are telling, okay, don't mix, don't sort and mix the waste prior to incineration. Now, see, we are talking about hospital waste. Okay, we're talking about hospital waste. So there will be a lot of waste. And just before incinerating, if we are sorting out the hospital waste, there it is little bit dangerous. Okay, so this sentence over here, it is not a safety procedure for the incinerator. Okay, this sentence over here, those who chose answer option B, this sentence over here, the reason for writing these notes is not, it is not to tell them how to safely operate the machine. It is telling them these are hospital waste. Okay, so therefore you have to be very careful, because it is very dangerous. Right, so that is the thing that you're getting over here. Now see over here, the last sentence also, care and judgment. So you have to be careful. You have to be very serious over here, as too much plastic will create dense dark smoke. So that is, if you are putting too much plastic over there, it will cause a dark smoke. So it is a warning. Okay. So can we really choose? Can we really say that the purpose, the reason for writing this letter is to give guidance on safety procedures? Okay, so not really. Compared to answer option A, it is not entirely, feasible, or it is not entirely fitting in. Okay, giving guidance. Okay, the purpose of these notes is to give guidance on certain safety procedures. Okay, so the guidance part, is it really talking about how to use the incinerator? Okay, see here the main thing is the incinerator, right? So you have to reason. Okay, so is the document written to guide the operator on how to carefully and how to safely operate the incinerator. That is not the reason. Okay, so this is a very tough question. I'm not saying answer option B is very easy to eliminate. Okay, again, that's why that much depth you must have. Okay, so we cannot actually suspect that B could be the right answer. We can say that B is not correct because the guidance is not regarding how to safely use the incinerator. Okay, the safety procedures are because too much plastic will cause a dense smoke, and hospital waste. Hospital waste, if you're mixing the last moment, you will get an infection. So that is the procedure. That is the warning they're giving, not how to safely use the incinerator operation. Okay, so so when you're thinking like that, you can say that is not the purpose for writing this letter. Now, what is answer option C telling? Answer option C is telling recommend one procedure for waste separation. So regarding waste separation, okay, there is just one procedure. And what is that procedure over here? Use a separate bag. Okay, that is at the source itself, from laboratories, from wards, when you're collecting the waste materials, use a separate bag. Now, can you say that is the reason for writing this letter? I mean, writing this paragraph? Definitely not, right? So answer option C is actually comparatively the most easiest to eliminate. Answer option B, not very easy to eliminate, but if you think very clearly, it could be answer option A. So what you have to do is, so if you get confused, that's the reason why don't directly come and choose the answer. This is why the elimination strategy is very important, right? So what you ideally have to do is, you will have minimum two answer options that you think is correct. So you feel A is also correct and you feel B is also correct. Okay, so you're stuck between 1 and 2. So now it is a 50-50 chance. So now when you have 50-50 chance, you have to once again come to the paragraph. Okay, once again come to the paragraph and try to eliminate which is the most difficult to eliminate. So now you have to think, okay, the purpose is to help the operator. Okay, yeah, helping is there, and to maintain high temperatures. So it's a very cheap machine. So therefore it should work very nicely. So to maintain high temperatures, what and all we should do? So compared to answer option B, I suspect that A is the most appropriate. So therefore, I will choose A as the correct answer. So A will be the right answer. Okay, so this question over here, those who are completely new to OET, don't worry. All questions will not be very difficult. This happens to be a very tough question. Some questions are a little bit easy. So here, the purpose is to help the person maintain high efficiency. Okay, and how did we choose answer option A as the correct answer? By eliminating the incorrect answer options one by one. So C answer option, it is a little bit easy to eliminate, right? C is relatively easy to eliminate. Now you're stuck with A and B. So once again, you come back and you read this thing, and then you reason with yourself and choose the correct answer over here, right? So this is the strategy. Okay, so this is a tough question, and this is the reason why we have developed our own app. Okay, so if you just open the OET exam mastery app, go to paracetamol overdose. There you can see reading part B, very long, lengthy lectures with photos, videos, animations, and all I have created. You can just go through the recorded lectures, even in Indian language translations are there. Very good slides I have prepared, and you can make some notes and you can come to an understanding. Right. So that is answer option. A will be the right answer. Right. So let's take a look into this particular document that we have prepared over here. So I would say that some the tricky vocabulary. Okay, so the OET will have a lot of tricky vocabulary and all. So judgment basically means careful decision making. Okay, and what are the skills? Okay, so over here you need to have the right skills over here. Right, it's not simply language skills. Just because you have very good language proficiency, you will not very easily crack the OET. Okay, so you must have very good understanding skills, a purpose type question. Okay, first and foremost, you must identify the question type. Okay, purpose type questions basically means why was this text written? So my duty is to find the overall aim, not just individual details. So when you're looking for individual details in a purpose type question, you fall into the trap of OET. Okay, so this is the entire reason why I'm guiding you in the the right direction. Okay, so here you need to be able to understand the overall purpose, that is to go beyond isolated facts, recognizing cause effect links. Okay, that is how actions lead to outcomes. Okay, so that is if you put high value fuels into it, then you will get high outcome. What's the outcome? High temperatures. So that linking ability you must be able to have. Okay, eliminating distractors. That is the incorrect answer options. Okay, there are certain words in OET that will eliminate that will distract you from the correct answer. So those elimination skills also you need to have. Okay, so I'll be sending you this, and you can go through the document, and you may choose that as again, you can do that after the session. Right. So now let's do one more question. Okay, so let's go to the fourth question over here, and let's hope that this is a slightly easier question, but I don't think so. This is I would say, a slightly tough question only. Okay, but anyway, just put in your effort. Okay, so comprehension, retention, detection, do the verb analysis, do the keyword analysis, try to eliminate the incorrect answer options. Okay, so I'll give you 2 minutes time to read the fourth question and the paragraph. This is a comparatively easy question. Here, if you do the elimination strategy, very easily you can find the answer. Mhm. Right? Give 15 seconds more. Okay, maybe in the last 10 seconds. Fine. All right. So compared to the previous question, this is slightly tough. Again, ideally to get the most of your, reading, it would be good if you have the printed materials with you. Okay, so if you go to Google Drive, if you can take the printouts, everything we have given you. Okay, other institutions every day they will give you one fake OET material, right? Every day, that to one fake material. Here from day one itself, we give you 100% official OET Cambridge University materials. No one else will do this. So again, you take the printouts, and in the sessions with me, if you have the printed material in your hand, it becomes much more easy. Okay, otherwise this is a little bit tough, no? You are seeing from a digital screen. Okay, but anyway, let's take a look into the fourth question. Now, what type of question is this? Okay, what type of question is this? Now, do you think this is a purpose type question? Okay, this is not a purpose type question. Purpose basically means what? To find why this manual was written. Okay, but over here, they're not asking you why. Okay, here they're asking you what. Okay, so one specific function they're asking you. Okay, so this manual is telling you, okay, it is telling you about a function about spacer devices. Okay, so for breathing problem patients, for inhalation and all, we have that device, right? So that is what we call as spacer devices. So here your duty is to find what is the function. Okay, what function is this manual telling us about this particular product? Okay, there is a product, and about this product, what detail is it telling? A very specific detail. Okay, so that is why it is comparatively easier. Now, what is answer option A? Answer option, now let's do the keyword analysis, right? So let's do the keyword analysis of option A. Patients should try out a number of devices with their inhaler. Okay, so here they are instructing the patients. This manual is telling the patients. So this is an instruction to the patients that patients should try out a number of devices. That is, so many devices they need to try with their inhaler. So they already have a product in their hand, and with this product they need to try many other devices. Okay, device number 1, device number 2, device number 3, device number 4. Like this, they need to try a lot of different devices with one specific inhaler. So there, what does the word there refer to? Okay, the word there is referring to the patients. Okay, so this idea you must have. Patients there. Okay, the patient should try a number of devices with their inhaler. So they have just one inhaler. With that, they should try different devices. Now let's come to the answer option B over here. Let's do the keyword analysis. They enable a patient to receive more of the prescribed medication. Now, what does the word they refer to? What over here? Now, here the word there is referring to what? It is referring to the word there over here is referring to the word patients. In this case, what is the word there referring to? If you want, you can type the answer in the chat box. I'll give you 5 seconds time. What is they referring to? Patients? No. The word they. Okay, so this is the clarity that students need to have. Yeah, very good. Okay, spacer devices. All right. So they is basically referring to the spacer devices over here. Okay, this is what it is referring to. Okay, so the spacer devices enable means to allow. It allows the patient, the spacer devices, it allows the patient to receive more of the prescribed medicine. So inside the spacer device, we will put the medicine. And if we are using this spacer device, it allows the patient. Okay, the spacer devices allows the patient to receive more amount, more quantity of the medicine. Okay, so that referencing skill you need to have. That is very, very important. So, okay, let's do the keyword analysis over here. They enable the patient to receive more of the medicine, prescribed medicine. So, keywords. Now, let's come to answer option C. Children should be given spaces which are smaller than adults. Okay, so for adults, we have bigger spaces, but for children, we must give them a smaller spacer. Right. So now let's do the verb analysis. Okay, because over here we need to eliminate the incorrect answers, and over here the elimination strategy is very, very helpful. Right. So let's do the elimination. Patients should, so what's the verb over here? Patients should try out a number of devices with their inhaler. Now see, try out a number of devices. That is the action over here. Okay, that is the action over here, and that is what this manual is telling us. Okay, what is the manual telling? It is telling you should try out a number of devices. Now, what is the verb in answer option B? They enable the patient to receive more of the prescribed medicine. Receive more. This is the action, right? The patients will receive more amount of the medicine. That is the verb over here. Now, what is the verb in answer option C? Children should be given spaces which are smaller than those for adults. So should be given, okay? Given spaces which are smaller. That is the action over here, right? So that is the thing. Now you see over here, from very long, lengthy sentences, we have smaller sentences. Okay, we have much more smaller sentences. Okay, so over here, the patients should try a number of devices. It allows the patient to receive more, and children should be given smaller spaces. Now you see, now you have cut short the thing. It is easier for you to register into your mind. Retention is much more easier. And Now what you can do with this clarity, you can go to the paragraph over here. You can go to this paragraph and you can try to pinpoint the right answer. So shall we do that? Okay, so let's see. So here, what function they're telling about this spacer device. That should be thorough in your mind. Okay, with that aim, you have to read the paragraphs. Manual extract. Okay, spacer device. Extract means what? Extract means a tiny portion. Okay, so when you're extracting blood, from the patient, what are you do? You're doing, you're just taking a small, tiny portion only. Okay, so a small portion. Okay, it's a very big instruction manual. From that very big instruction manual, a small portion you are taking. That is why it is called as a manual extract. Okay, spacer devices for asthma patients. Now let's read the sentence number 1. Spacer devices remove the need for coordination. Okay, coordination between actuation of a pressurized meter dose, inhaler, and inhalation. Okay, so coordination basically means what? So, see, for example, when you're driving, you need to have eye and hand coordination. Both your eyes and hands and legs, everything should be working in coordination. So when multiple things are working together harmoniously, that is what we call as coordination. Okay, so here they're telling spacer devices remove the need. Remove the need means what? There is no need for multiple things at the same time. Okay, actuation. Actuation means activation. Okay, activation of the pressurized meter dose, inhaler, and inhalation. So without spacer device, you have to have inhalation and activation of the meter dose. Both you have to do simultaneously. Okay, but with this spacer device, there is no need. Okay, you can do it separately. Okay, this is British English, and that is why it may look like a very small sentence, but there is a lot of meaning inside it. Okay, so now let's come to the second sentence. In addition, the device allows more time for evaporation. So they're talking about the benefits. So this is benefit number 1. Okay, there is no need for coordination between inhalation and activation of the inhaler. Now, what is the second benefit over here? The additional benefit. The second benefit is the device allows more time for evaporation. Okay, so evaporation happens very slowly. Okay, more time is given for evaporation of the propellant. Propellant basically means something that pushes. Propeller. Okay, something that propel means push. So see, when you're using the inhaler, something will push the medication, right? It pushes the medication from the device into our mouth. Okay, so it allows more time for evaporation of the propellant so that a larger proportion means what? Larger quantity. A larger quantity of the particles can be inhaled and deposited in the lungs. Now, have we read this before? Now, what is answer option B? Answer option B is telling they enable the patient to receive more of the prescribed medicine. That is, more quantity of the medicine will be entering the patient's body. The patient will receive more quantity of the medicine over there. Now you read this sentence over here. And what sentence telling? In addition, the device allows more time for evaporation of the propellant so that a larger proportion means what? More quantity of the particles. So what are we inhaling? What gets deposited in the lungs? The medicine, right? So see, this is how the OET tricks you with synonyms. That is why if a student is simply reading without putting effort into the question, they will struggle in the paragraph. Okay, so put some effort over here because they will never repeat the same words. Now you see over here, a larger quantity of the medicine can be inhaled and deposited in the lungs. So now itself what you can do, you can put a question mark over here. Okay, see, you have not even read the third sentence. Just by reading the second sentence itself, you almost suspect that B is the answer. Because what is the keyword over here? It receive more of the medicine. Okay, the medicine is the keyword is mentioned. Yes or no? Right? The keyword is mentioned. Okay, the spacer device is mentioned. The verb is mentioned. Receiving more quantity. Everything is mentioned. Okay, and just in the second sentence itself. So you have a very strong suspicion that B could be the right answer. Okay, not yet confirmed, but you're suspecting it. Okay, so now let's read the third sentence. Spacer devices are particularly useful for patients with poor inhalation technique. So people who don't have proper inhalation technique, for them it is very, very useful. So they are talking about the third benefit. Third benefit is useful for those type of patients. For children, for patients requiring higher doses. So some patients they need very high dose. For children they don't have inhalation technique. Okay, and for patients with nocturnal asthma, nocturnal means what? Sleep. Okay, so those who have asthma when they are sleeping. Okay, for those patients, and for patients who are prone means what? Vulnerable, who are susceptible, more likely to get candidiasis. That's a fungal infection with inhaled corticosteroids. Okay, so those who are using corticosteroids, they are at risk of developing fungal infection. So for all these people, spacer devices are very, very helpful. That is the third benefit. Now they're talking about the size. The size of the spacer is also important. Larger spacers with one wave wall is the most effective. Okay, so with one wave wall, bigger spacer are the most effective. It is important to prescribe a spacer device that is compatible with the meter dose inhaler. That is compatible means what? It is matching. Okay, so when we look into a couple, we say, oh, they are very compatible with each other. That means both of them are good match. Okay, so over here, it is important to prescribe a spacer device that is a good match with a very good inhaler. Okay, these are all distractors. Okay, these are all distractors. That is why reading the question is very important. If you read the questions first and the answer options, you will be able to identify what sentences are distracting you. So these are all distractors. Nothing is related to the answer options. Now let's read the last sentence. Spacer devices should not be regarded as interchangeable. That means we must not interchange the usage. Patients should be advised not to switch between spacer devices. Switch means what? Keep on changing. That is, day one, Monday use this, Tuesday use another spacer device, Wednesday use another spacer device. So like that, you must not switch. Okay, that is not a very good idea. Okay, that is what we are talking about over here. Now, let's come to the questions. Okay, now let's come to the answer options over here. Now, what is the verb in answer option A? Answer option A, what is the verb? Patients should try out a number of devices with their inhaler. Patients should try multiple devices with their inhaler. Now, don't you think this is the exact opposite of what we read in the last sentence? Okay, see, what is the verb over here? Patients should try different types of devices. Now, what did you read in the last sentence over here? Okay, patients should be advised not to switch between spacer devices. Okay, that is, don't use the devices interchangeably. Okay, so it is the exact opposite of answer option A. So this is what we call as an extreme contradiction. Contradiction means what? The exact opposite is mentioned. So in the paragraph, they have written what they have written. Do not, okay, do not change or do not try a number of devices. So this is the verb over here, and the exact opposite of the verb is mentioned in the passage. So you can very easily eliminate answer option A. Now you have 50-50 chance. Now it is either B option or it is C option, right? Now let's come to B option. Now what is the verb in answer option B? They enable the patient to receive more of the medicine. Is this verb mentioned? Okay, receiving more. Okay, medicine. So the keyword is mentioned, the verb is mentioned, this verb is also mentioned. So each and every keyword over here, okay, is mentioned in the passage. The verb is mentioned. Yeah. Just give me a second. I believe there was a small network issue. Right. So technical glitch, sometimes, very rarely it happens. I'm not sure why. All right. So anyway, thank you for everyone being patient with this. All right. So now, what were we talking about? Yeah, we were talking about answer option B. Okay. Yeah. So receive more of the prescription. Everything is mentioned. The verb is mentioned. The keywords are also mentioned, right? So what you can do, you can suspect, okay, you highly suspect that B is the right answer, right? And we have eliminated answer option A. Now let's come to the third answer option over here. 1 second. Yeah. Now what is the answer option third over here? What is the verb over here? Children should be given spaces which are smaller than adults. So what is the verb over here? Give spaces which are smaller. Did we read this? Did we read anywhere that children should be given smaller spaces? It is not mentioned. Okay, this verb over here, it is not mentioned, right? So since it is not mentioned, you cannot choose answer option C. So we have eliminated A, we have eliminated C, and in the very beginning itself, just by reading the first two sentences, we have suspected B as the correct answer. So B is the answer option, which is the most difficult to eliminate, and therefore B will automatically by default be the correct answer. Okay, so like this, if you are bringing in the elimination strategy, give importance to the verbs, give importance to the keywords, right? And then you eliminate, don't focus on trying to find the correct answer. Instead, focus on eliminating the incorrect answer options, and then it becomes easier for you to choose the correct answer. Okay, so this much clarity, okay, this much clarity you should have when you are approaching the questions along with the answer options. Okay, only then you will be getting the desired OET quiz. And this requires repeated exposure to the Cambridge University materials. Now, all these recorded lectures already are available in the app. Okay, so you just have to open the app and you can just go through, scroll down. Very detailed lectures are available. You can make some notes. Okay, so this is the proper way to do an OET reading. If you have a printed material in your hand, well and good. So that with my live sessions, you can do the keyword analysis, verb analysis, so that it is easier for you to find the correct answer. Right. So this is what the fourth answer option is. The answer option will be B. Right. So here also I have actually prepared a document over here. So let's have a small discussion regarding the document. So I'll be sending you this document through WhatsApp. Right. So you can go through it after some time, right? So this question type, okay, so this question type over here, it is not a reasoning type question, okay? It is about a device and they're asking you what particular function this question is asking, okay? So you have to use the main use, benefit or function of a product. Now, what are the skills you need? So this is the thing. This is the most important word I can say. Okay, it is not about knowing good English. It is about knowing what question type you're dealing with and what skills you need to implement over here. Okay, inference, scanning, skimming, keyword matching, paraphrasing. Again, synonyms. Now, see, the correct answer option was B option. Okay, there was, see, receive more of the medicine. This was the answer, right? But not a single word. Not a single word was repeated in the passage. So you need to have good synonym recognition skill. Okay. And also there are very tricky vocabularies there. Now see compatible. So if a student does not know what is the meaning of compatible, they will really struggle. So compatible means it works well, right? Interchangeable, not interchangeable means what? It cannot be swapped, right? And evaporation, okay, means allow better delivery. So like this, you must be able to understand the paraphrased meaning. Okay. So B is indeed the right answer. Right. So I'll be sending you these documents so that it becomes, so you can refer through it. All right. So that is the end to the today's session.